And good afternoon. I'm Dr. Deuk Majan at the Deuk Spine Institute. We are performing the Deuk Plasma Rhizotomy, a novel procedure for treating facet joint pain in this patient's back. She's from Kansas. She's traveled here because she has back pain. She's been unable to get relief in Kansas. And we just finished her Deuk laser disc repair. We're now going to be performing the Deuk Plasma Rhizotomy for facet pain. She has 6 causes of back pain. 6. We've just fixed 3. Shot? All right, you can see the tip of my probe is at the bottom of the transverse process of L3. Show us the transverse process, Jordan. Show us our target. Our target is right where the arrow is. Shot? And that's where I'm headed. Okay? So I can feel I'm right on the bone. I'm in the perfect spot. I'm going to apply a lesion, and I'm using plasma energy to do so. It's right at the junction of the superior facet and the transverse process. All right, so I just completed my first burn, and I want to reposition my tip. I'm going to try to get it right in the spot right there. Shot. Oh yeah, see that little valley right there between the TP and the superior articular process? That's where this pain nerve runs. It's called the medial branch of the dorsal ramus. All right, 1 down. Next will be L4. So where there are discs, we name them based on the bone above and below, L3-4, L4-5, L5-S1. Where there are facet joints, we do the same thing. The L3-4, L4-5, L5-S1 facet. Shot. All right, too low. Need to be a little more superior. Shot. Is that it? Still too low. Shot. Still too low. Show us the pedicle. You guys see the pedicle there?
Yes, we do.
That's our lateral pedicle is our target. Show us our target. Yes, lateral shot. I can feel the bone. I need to be just a little more medial. I can feel it. Oh yeah, that feels good. You never want to do this if you're not on the actual transverse process. If you're too far in, you're going to create a complication, a really bad one. So it's not an easy procedure. Then again, it isn't brain surgery either. Right, Luis? I remember when we did craniotomy here for the first time, so that's really good. All right, we're done with 2. We're going to move on to the 3rd.
You did craniotomy here?
I did a craniotomy here. Yeah, because that's how I roll. The patient had a skull lesion, and I took the skull lesion out. I didn't go in the dura. I stayed outside. So, but we did a skull lesion excision, and I filled it up with methyl. Shot? Were you there for that, Luis?
No, sir.
That was a long time ago. Oh, perfect. And I feel the TP.
I was not here for that.
No, I know. You know, our first surgery we ever did here at Deuk Spine was a spinal cord tumor. You talk about Gahunyans of steel. Dude, taking a spinal cord tumor out at the cauda equina, at the conus in a patient with intradural, intramedullary, extramedullary. I had to open the dura and take the tumor out and sew it all back together. Meanwhile, I did intraoperative monitoring. That was our very first surgery. That was crazy. Neurosurgeons would never, nobody I know would ever do that surgery outpatient, except for me. I just had so much confidence. That's what happens when you get trained at the top training center in the world in neurosurgery. You get confidence, as long as you're actually good and you learn something, which I was. All right, show us the target there, Jordan.
The last level?
Yeah, we're done. I just got to do this last thing. Shot? Right where the arrow tip is, that's my target. I'm trying to get there. And it just takes, moving around a little. And a few x-ray shots. I should be there in just a moment. Shot. Look, progress is made by the bold. Let's face it. You don't make progress in life by doing the same thing everybody else is doing. Otherwise, it wouldn't be progress. You got to do it better. You got to do it faster. You got to do it more reliably. And I just knew there was a better way to do things. I think I'm on there. I just don't know if I'm bouncing on her fascia. Shot. I feel like I'm there. The blade is deflected. I feel the facet joint. Right here, it feels like facet. Shot. Yeah, I'm on the facet. So, yeah, I'm in the right spot. That's it. We're done. That went well. Good job, everybody. I think she's going to do fantastic. Let's show the audience the incision for the DPR. You have a little Raytech? Yeah. So, guys, gals, everything else, 4 millimeters. You never know. So there's the laser surgery incision. There's the plasma surgery incision. Great job, everybody. Thanks for joining us, folks. If you have more questions, type them up. Any questions, Henry?
No current questions.
All right, next we're doing a foot with DPR, a patient who's supposed to have her foot fused. She saw a foot surgeon. She's been putting off surgery for years. She finally can't walk anymore. Her foot hurts so bad, her ankle, her metatarsal, what is it, the tarsal-metatarsal joints? What is it called? Metatarsal phalangeal joints and her tarsal cubital. Yeah. Anyway, the joints in her foot are hurting, and she doesn't want a fusion. So I told her, let me try the DPR. So we're going to do that next, but we're doing it in room 2, so we don't have a camera. We'll be back with you guys for one more surgery at the end of the day, which is a single level DLDR. Lumbar. All right. Very good. Thanks for joining us. You can sign off, Hen.